My name's Jordan Broekhuis. I'm originally from Sioux Falls, South Dakota. I went down to the University of Nebraska at Lincoln for my undergraduate degree, and after that came up to Omaha and went to med school at UNMC here. After that, I went out to Boston for my general surgery residency at Beth Israel Deaconess Medical Center and Harvard Medical School. At that point, I got my master's in public health from the Harvard Chan School of Public Health. And following that, I went on to the Massachusetts General Hospital and Brigham and Women's, where I completed an endocrine surgery fellowship. It wasn't until college when I was thinking about what I wanted to do, and I actually studied music and played the piano, and then took some science classes and saw some parallels in surgery where technical skills style of learning translated well. And I had some connections and did some shadowing, and I really found I enjoyed that experience learning medicine and learning the practice of surgery. So endocrine surgery is a really unique specialty because it has a lot of unique physiologic and pathophysiologic problems where you can understand the normal endocrine physiology and then understand the context by which these problems develop and how we can address them through surgery. So it's a really interesting career where I can work with patients to help them understand how their symptoms relate to their problems and then formulate an individualized plan and make decisions with them about how we can use surgery to help them feel better. So I specialize in endocrine surgery, which is the surgical management of problems of the thyroid, parathyroid, and adrenal glands. So a lot of what I treat are benign and malignant nodules of those glands, but also times where those glands are producing too much hormone for the bodies that results in patients experiencing symptoms. And so I can help patients identify these problems and think about how we can solve them with medications and surgery. And so surgery allows patients to come in, have an operation, recover, and then feel better, which is very rewarding for me and for patients. And I provide also minimally invasive approaches to these operations. I've always enjoyed teaching and working with medical students and residents, and so this provides an opportunity to do that and also kind of be part of the mission of serving the state of Nebraska and the surrounding communities. I have interests in research in the areas of access to care and systems and policy evaluation, and so being at a place like this where the policy of the state impacts the care and that we're able to provide is really in line with what I'm interested in academically. So I enjoy living and working in the Midwest. It's where I'm from, it's where my family lives. I lived here for many years prior to training out on the East Coast. And so it's nice to be back in the Midwest at a place that is academically minded with people in a community that I grew up in, and it feels like coming home for me.